Hey guys, what's going on? So I wanted to come on here today and talk a little bit about oral health and what I've been personally going through in the last several months since about July of last summer. And basically I went and saw a biological dentist or like a holistic dentist here in Houston, Texas. And she did a cone beam scan, which is basically just like a 360 x-ray of your entire head and your neck so they can look at your airway and your throat. And basically what she discovered in that cone beam scan is that I have a very narrow airway. Okay, so when I was young, I had braces. And in order to get braces, the dentist removed 4 of my main adult incisor teeth. So 2 from the top, 2 from the bottom. And basically what he did was he then put braces on and kind of smushed my whole mouth together, okay? So this created a situation where my tongue now sticks into my airway. So it's kind of like if you have your airway, you've got your tongue muscle. Well, my tongue muscle kind of pops into my airway. It can create issues in the long term for oxygen supply, right? So the biological dentist basically described it as my body's kind of delegating who gets oxygen and who doesn't and who gets how much and etc. And so that can affect a lot of things, obviously, with your brain, with your heart, with your hormones. So this was very new information for me, and I was like, what? I just came here to get my teeth cleaned. And so basically I've been on this journey ever since then with trying to research and become more educated about the symptoms and other implications that can happen because of this. And so my biological dentist basically recommended an oral DNA appliance, which would be put into my mouth. And it's kind of like reversing braces, where every couple of weeks she would go in and she would twist the knob and she would basically grow my palate and give my tongue more space, okay? What she proposed was super expensive, so I actually went on my own journey and got some other recommendations. And through them, I actually have a friend, Brian Hoyer, and he recommended a dentist that they see for his family. Now, granted, they're up in Missouri, so that wasn't going to work for me, but the office did recommend someone here in Texas, in San Antonio, actually. His name is Risto Hume. And if you want to learn more about what he does, you can go to tmjsanantonio.com. They work with a lot of people who have a lot of pain. So you kind of also have to think about, if your airway is pinched and your mouth is kind of misaligned, then it can create a lot of factors down south to where your neck is unaligned, your spine is unaligned, your shoulders, your hips, and that's where a lot of people get their chronic pain from. Also headaches too. So if you're not sleeping well, that kind of thing, it's something to look into if you haven't. But anyways, long story short, I found Risto Hume, and he recommended ALF, Advanced Lightwear Functional Appliance, okay? So I have this in my mouth right now, and pretty much long term, I'm gonna be wearing this thing for a year. It's gonna be a very interesting journey, and I hope to take you guys on it with me. But he's going to grow my palate and expand the space in my mouth so my tongue has more room. And this should also help a lot of my other symptoms that I didn't really knew I even had. I have a shoulder injury from March of 2017. I'm not able to fully heal it after physical therapy and all of the work that I've done. And he really is confident that this is going to help my body get back into alignment and heal. Now, granted, the small airway thing is kind of what led me to all of this, but when I saw Risto Hume, he went through my cone beam scan, and he really got into the details of how my jaw was misaligned, okay? So my bottom jaw kind of sat more to the right than it should. I had a lot of rubbing on my bones, and actually right here where it connects to my earlobe, my bone was already completely almost rubbed away from that friction. And so just the whole misalignment with everything that's going on, but also just from having braces and them shoving my teeth, it's really interesting. Like my bottom teeth are kind of sat back a little bit. They're not straight. It's just a lot of nitty gritty detail stuff that he got into with me. And so there's a lot of alignment that needs to happen. And so over the next year, that's what I'm going to be doing. It's going to be really interesting. So I'll actually have a little bit of space in the back teeth back here, but my tongue will have room, my neck will get realigned, my spine will get realigned, and long term, I should be in a better position musculoskeletal wise, you know, physically, than I would be if I had never addressed this. So really interesting information, but there's a ton of information out there on like how this is related to sleep apnea. So if anyone out there has sleep apnea, if you think you have any kind of obstructed airway in any way, you should go get a cone beam scan. If you've got chronic headaches, if you have chronic pain, chronic anxiety and stress too, I mean, this can just be something that puts a stressor on the body. So it's something to look into. But really interesting. I got completely eye-open to this, again, when I first went and saw my biological dentist here in Houston, Texas. Her name is Teresa Scott, if you guys want to look into her. Really educated, fascinating lady. She knows her stuff. And so this is the beginning of my journey. And I just kind of wanted to bring this to your attention in case you or someone out there who has recurrent injuries or pain, headaches that won't go away. This could potentially be something that you might want to look into to see if this is a part of your problem too. All right, let me know if you guys have any questions. You can always reach out to me on my website, megangump.com. I also do free 15-minute consultations, so if you want to learn more about working with me through functional medicine and nutrition, that is what I do. I run labs on people, stool tests, urine tests, saliva tests to really look deeper into the root cause of your health concerns and symptoms. So if you've got headaches or pain, if you have GI dysfunction, if you have gas, bloating, diarrhea, constipation, if you are super stressed, if you've got a lot of anxiety in your life, if you're tired all the time, if you just don't know what the heck to eat, please reach out to me. I'd be happy to work with you and get that all figured out. All right, have a good day, guys.